Hello there. It's time to learn about iron deficiency anemia. If you want to learn about the signs and symptoms of iron deficiency anemia as well as the treatments, then this, my friends, is the video for you. What we're waiting for, let's begin. Okay, so let's begin with sign and symptom number 1. I do this one in clinic all the time with my patients. What you're gonna do is you're gonna pull down the lower eyelid like so, have a look at it. If it's pale, we call this conjunctival pallor. When you have conjunctival pallor, in association with other symptoms, there's a high likelihood of anemia. Moving on to sign and symptom number 2, you may have a pale or sore tongue. You may also have pale skin, okay? You can have the two together. All of these, remember, signs and symptoms, they don't actually diagnose anemia. So if you have one of these, it doesn't exactly mean that you've got anemia, but these are the signs and symptoms to be aware of. You will have to speak to a healthcare professional to make that diagnosis though. Moving on to sign and symptom number 3, shortness of breath, and you may also have a faster heartbeat. Remember, with anemia, the blood cells are less efficient at carrying oxygen. This is gonna mean that because we're not carrying as much oxygen, we're gonna be a lot more short of breath. You may also have a faster heart rate as a result of it. Remember, the normal heart rate of an average adult should be between 60 to 100 beats per minute. So moving on to sign and symptom number 4. Sign and symptom number 4, brittle nails, pale nails, hair loss. All of these can be those sort of signs and symptoms. With iron deficiency anemia, we're going to produce less hemoglobin. Less hemoglobin means that we're not going to have as much hair growth as we should be having. Okay, so let's move on to sign and symptom number 5, extreme tiredness, dizziness, headaches, cold hands or feet. All these are really due to iron deficiency anemia causing us not to be able to carry enough oxygen to our cells, as well as poor circulation. Moving on to signs and symptoms number 6, unusual cravings. This one is quite often missed by patients, and it's cravings for non-nutritive substances, okay? Like wanting to chew on ice, wanting to chew on dirt, wanting to chew on starch. All these sort of random cravings that come out of nowhere. Okay, so that is signs and symptoms done. The most important thing is you now know about them, so please make sure to speak to a healthcare professional so they can do the relevant tests and check for any underlying causes. That is one of the most important things. Now that that's done, once you spoke to your healthcare professional, let's say you've got a diagnosis of iron deficiency anemia. So here's a few things that they might recommend, and here's a few things that would be useful for you to know as well about treatments. So let's begin. Okay, so tip number 1, make sure you are getting enough iron from your diet. We're talking meat, we're talking red meat, we're talking poultry, we're talking fish, we're talking certain vegetables, we're talking pulses. I'm gonna leave loads more information in the description below on iron-rich foods that are going to help. Moving on to tip number 2, vitamin C. I know this sounds random, but there's loads of studies that have shown that vitamin C can increase the absorption of iron. So if you're having iron-rich foods, if you're having iron tablets, make sure to have some vitamin C in orange juice. It's completely fine. It's going to help increase the absorption. Moving on to tip number 3, you need to avoid caffeine, you need to avoid dairy, especially when you are having iron tablets or iron-rich food, okay? Caffeine, dairy, they all absorb to iron and they stop it from getting absorbed. So you need to avoid this or leave at least 2 hours between your iron-rich meal or your iron tablets, anything like that. Moving on to tip number 4, take your prescribed iron tablets, take them as prescribed, take them with orange juice because remember the vitamin C, and avoid taking them with caffeine, avoid taking them with dairy because all of these are going to reduce that absorption. I can't speak. Now please also remember some people cannot tolerate iron tablets. They cause constipation, they can cause diarrhea. So if you want more information on how to reduce these sort of side effects and how to take your iron tablets properly as well, I do have a full video all about that, which I will leave a link to up here and in the description below. So it looks like we've come to the end of this week's video. I really hope you found this information helpful. If you've got any of your own tips, leave a comment below. I'd love to read it. Everyone watching this video would love to read it. And as I always say at the end of every single week's video, let me change hands. Always remember you're awesome, and I'll see you next week.